Hello and welcome to PW2002 More Medicines Management. Welcome back to the second year. I hope everybody's well. Here we're going to do a few little videos just to welcome you. I felt it's better so you can see me as I'm going through some of the PowerPoints. I've got a nice introductory PowerPoint here and it's going to introduce you to the assignment. This is something that you can keep going back over to go through what I want you to do for the assignment, how to break down the different learning outcomes, and I'll also go through these in a bit more detail as we go through the different sessions, linking your sessions to the different things that are required as we're going through the module. So as in this module, the aim is to develop your understanding of the fundamentals of pharmacology and the therapeutic effects of major drug groups on the body. We'll also link a little bit to your numeracy and drug calculations as we did in the first year module, but we're also going to look a lot more at specific medications that are used within your areas of practice. And the whole point of this module is for you to choose a medication and to be working on that throughout the module to build a good understanding of one or more medications that are really key in your specific areas of work. Because we're still online, obviously we're going to have a little bit of a different way of doing it this year, but you'll have some key lectures or PowerPoints or links to videos and things from me. We'll also have our group seminars later on in the day where we can come together, we can look at some of the tasks and we can look at how this relates to our individual practice. And you'll also have your directed study sessions where I'm going to set some tasks, some areas for you to look at, and this is really an opportunity for you to be developing your research and your knowledge on your key medication so that this is going to really work towards your assignment. My hope is that as we go through this module and the tasks that I set each week, by the time it actually comes to write your assignment, you should have already developed all that key research and all the key knowledge that you need to be able to finish your assignment in a good time. So when we're thinking about the assignment, what is it? So I know that for some of you this is your second medicines management module. So you already did the introduction to medicines management in the first year where we looked at some of the concepts and you looked at some of the maths. This year I know some people are entering medicines management for the first time, but don't worry, I am going to recap some of the key concepts and things which are really, really useful because this is really key to both the people who've already done it and people who are coming into it. But whereas in the first year it was an exam to have a look at what your knowledge was, and we really looked at some of the key things with storage and the legislations and some of the backgrounds, this is really going to be looking more at your specific areas, your specific roles and specific medications that you might come across on a daily basis. So the assignment is a 3,000 word assignment, and within this assignment you're going to look at 4 learning outcomes. The 4 learning outcomes which are going to be discussed are demonstrate knowledge and application of the safe ordering, receiving, storage and disposal of medicines, apply the fundamental principles of pharmacology in practice, explain how legal and ethical frameworks underpin safe and effective medicines management and administration, and then, even though it's half hidden by me, explain and discuss the advantages and disadvantages of working in partnership with patients, clients and carers in relation to self-administration and management of medicines. So I'm going to start talking through how this assignment is actually going to be put together and what I'm actually expecting from you. So the assignment should be in your traditional essay format. It should be word processed in Arial size 11 or 12, black font, and your work needs to be double spaced. All your pages need to be numbered and your word limit is 3,000 words. Obviously this is plus or minus 10%, so it could be 2,700 or 3,300. We are, like always, using the APA referencing style, and if you are going to use a case study or you're going to be discussing your work area, please remember to protect the identity of that particular area. The only area where this might be harder in is if you're relating to a specific policy, whereas in your assignment you would write according to local trust policy or according to local policy. and then give your reference as Trust Policy 2019, for example. Whereas in your end text reference list, you would put the full reference for the policy that you are talking about, so it could be found if needed. But in the main body of your assignment, you need to remember to be protecting the identity of where you're actually working. So what does this actually mean? So we've introduced some learning outcomes, we've introduced some of the key things that we're going to be looking at, but what does this actually mean? So as I said, the first thing that you need to do, and one of the tasks that we're going to look at within the first session, is actually picking your medication. So you'll be asked to think about your area of study and your area of work, and think about either your patients or your clients or your service users, and think about a medication that you are coming into contact with regularly. Now, this might be a medication that you're using or that clinicians within your area use, or it might be a medication that a majority of your patients are on. For example, blood pressure medication, or it might be cardiac medication, it might be antidepressants, it could be diabetes medication. Think about the key medications that your patients are on, and then we need to work our way through to be identifying which medication do we feel that we want to use to form the basis of our assignment. This is the one that we're going to do all our research around, and this is the one that we're actually going to focus our assignment on. So it might be that you're talking about a specific client or service user and you would wish to use a case study to talk me through, for example, Bill, who has diabetes, and then you can link some of the key areas as we go through the different learning outcomes to Bill and his diabetes medication. And this might help us when we get later on into some of the learning outcomes. Or you might want to just ignore a case study altogether and just pick a specific medication and have you focus on the medication. So for example, if we were thinking about Bill and his diabetes medication, it might be that you want to identify metformin as your key medication and then use metformin as the focus of your assignment as we're going through. So for learning outcome 1, the first thing we need to do is for you to be able to demonstrate a knowledge and application of the safe ordering, receiving, storage and disposal of this particular medication. So as it says, we're trying to discuss within this first learning outcome any relevant issues in terms of the ordering, receiving, storage and disposal of this medication. So what does current legislation or policy tell us about this particular medication? Now, as I said, I know that you might not be dealing specifically with prescribing or administering the medication, but when we are thinking about, for example, as we said, metformin, what are the legislations or policies that underpin the ordering of this medication? How would we receive this medication, both in practice if we were in a hospital setting or if we were in the community setting? How does this have to be stored? Obviously, for the example of metformin, we have to be following safe storage instructions and keeping it cool. So what does that mean? Why do we have to keep metformin cool? And does it have to be disposed of in a particular way? Can it be thrown away? Obviously, we shouldn't be doing this with any medications. How should we be disposing of our medication, both within a hospital setting and within a community setting? Thinking really about things like it should be returned back to the pharmacy if we've got any unused or out-of-date medications. This is really thinking about your referencing. You need to be underpinning it with your relevant legislations, policies, procedures, protocols, anything that you think is key when we're thinking about safe ordering, receiving, storage and disposal of the specific medication that we have chosen for our assignment. It might be that you use a little bit of general discussion about what these things are or what legislation says about these things, but remember the focus of this assignment is your chosen medication. So it's really key that not only do you give me the general information about legislations, etc., but you're then linking it back and applying it to your chosen medication. Remember, we're in the second year now, And I really want you to start thinking about what this application of theory means. So what does it mean? Do we know about the legislations? Do we know about the key issues? But how do we really apply it to our key medication? So the second learning outcome, this is probably going to be one of your most in-depth learning outcomes. And this is really where you're going to apply the principles of pharmacology in practice. So in the first session, we're going to do a really good recap on the pharmacokinetics and pharmacodynamics of medication and how a medication actually works within the body. But this is going to be a general overview with no specific medication in mind. But what you have to do is to be able to relate all the discussion around pharmacology, pharmacokinetics, pharmacodynamics to your chosen medication. So as it says, you want to be discussing the relevant pharmacology of your drug, thinking about the fundamental principles of pharmacology. So you want to be thinking about your pharmacokinetics and your pharmacodynamics of the drug, and any other key pharmacological processes like absorption, excretion, biotransformation and distribution. And then you might also want to talk about anything that might impact the effects of your medication on your patient. For example, comorbidities, impaired renal and liver function, or any other drug interactions that might occur. So this is going to be really key for you to either use the BNF, to use articles, to use other things that are going to explain your medication in more detail. So how is your medication taken? Is it taken orally? If it's taken orally, what does this mean as it passes through the body? As we're talking through the processes of absorption, as we're talking through biotransformation, distribution, and then finally excretion. If we're taking a medication intramuscularly or subcut, if it needs to be injected into the body, what does that mean? How does that change compared to an orally taken medication? What are the key factors for your medications as they're being taken by the patient? So it's really important that you properly look at, as we go through this module, as I said, each week we will look at little bits of this module, but how it affects the body. You're going to have to go back to your anatomy and physiology sessions or your anatomy and physiology notes to be thinking about, why is Bill, if we're going back to this first patient, taking a medication for diabetes? You might need to do a tiny little bit of an introduction to what is diabetes, talking me through why the body doesn't properly use insulin or create insulin, and what this means. So why Bill has to now take something which is going to help him to process those sugars to actually be able to metabolize them correctly. What actually happens when we take that medication into our body? So if I'm taking a medication orally, how does it pass through the digestive system? This is going to link nicely into the absorption of the medication. How is it absorbed through the digestive system and get into the bloodstream? What actually happens when it gets into the bloodstream? So we're now talking about the biotransformation and the distribution of the medication. Is our medication affected by a first pass effect within the liver? So is it actually broken down and a large portion of this drug actually metabolized before it hits the distribution and before it's taken around the body by the cardiovascular system? How is it distributed? Is it distributed systemically? So does it go to every cell within the body? Or does it stay within one particular area and only act on one particular part of the body? And then how is it excreted? Once it's had its effect on the body, is it then excreted through the urine? Is it excreted through the respiratory system? How is it excreted from the body's systems? And is there anything that we need to be aware of? And this is then how it is going to link into our comorbidities, that if our medication is excreted through the renal system, is this impacted by somebody who has an impaired renal system? If it is impacted in the biotransformation centre in the liver, is this affected by somebody who has a renal problem? And if our patients are taking multiple medications, are any drug interactions going to occur? So we're going to spend a majority of our module actually looking at what does this mean? How do our medications affect the body? And what are the key things we have to be thinking about? But it is really important that once you've chosen your drug, that you start to do your research around your specific medication. Look at the leaflets that are included within the medication. Look at the information that's within the BNF. Do a quick search to see if there are any articles that are written about your particular medication, because most medications have had lots and lots of research created or done on them, and there might be a lot of really good information out there within different articles, within different resources that actually talk you through these processes in relation to your specific medication. I'm not asking you to do something that hasn't already been explained in other research. I'm asking you to do the research to find those explanations. So for learning outcome 3, this is then going to take this a little bit further, and we're going back to our legal and ethical frameworks and how they're going to underpin safe and effective medicines management and administration. So once you've introduced me to your drug, you've introduced me to why we have this specific drug, how we get it, how we order it, how we would then dispose of it. You've talked me through the different medication and what it actually does in the body, how it affects the body and how the body affects the medication. You're now going to tell me where this medication actually sits within legal and ethical frameworks. What do we have to think about when we're actually delivering our medications? As I said, I know that not all of you actually have input into administration or prescribing of medications. But when we're dealing with patients who are being prescribed medications, what are the things that the prescribers or the administrators having to think about when they're actually helping or supporting these patients? So this section should include a thorough explanation of the legal and ethical frameworks that operate in the arena of safe and effective medicines management. So you might want to give me an overview of some of the legislations that are out there. It might be that you want to discuss some of the key things. It might actually be within this learning outcome that your explanations for learning outcome 1, when you were talking me through some of the safe ordering, disposal, storage of these medications, you've already started to discuss the legal and ethical frameworks, because these actually underpin safe ordering, safe storage, safe disposal of medications. And actually learning outcome 1 and learning outcome 3 might actually start to blur together. So as long as you can justify, in however you choose to set out your assignment, that you've actually talked me through the legal and ethical frameworks, and you've linked it not only to storage, administration, ordering and disposal of medications, but you've also looked to safe and effective medicines management, and you've linked it to your chosen medication, you might actually complete learning outcome 1 and learning outcome 3 within the same section of your work. Learning outcome 4 is the last learning outcome for this assignment, and this is asking you to explain and discuss the advantages and disadvantages of working in partnership with a patient or client or carers in relation to self-administration and management of medicines. So again, this needs to relate directly to the medication that you've chosen, and I want you to think about issues around self-administration of medications and look at this from the view of a service user, carer, patient, whoever actually might be dealing with or managing that medication. Now hopefully you've picked a medication which can be managed in a self-administration role. So is that patient able to administrate this medication themselves? It might be that they can't administer this medication themselves. It might be that you've chosen a medication which is specifically administered by a practitioner within the area that you work. That's absolutely fine, but think about what is self-administration of medication, and why couldn't a patient or service user administer this medication themselves. What is it that has to underpin self-administration of medication, and why can't they do it? Within this area, you might also want to look at what is self-administration of medication, why is self-administration preferred in certain cases, and what could actually compromise self-administration of medication when you're thinking about issues such as capacity, whether a patient has things like dementia. Are there any other issues that could impact the self-administration of medication? You might also want to talk about things like blister packs or pharmaceutical involvement, looking at how we can make administration of medication safe for our patients or service users. And what might happen if we have to have things like carers or outside practitioners coming in to assist in the administration of medication. So there's lots and lots to be thinking about when we're talking about self-administration of medication. We will be looking at this in subsequent sessions, so again, don't worry too much if it doesn't make much sense to you now. But these are just some things that you might want to think about if you're looking at or thinking about your assignment. Obviously, there's lots and lots of key things on Blackboard. We've got our lecture materials, workbooks, further reading, additional resources and handbooks. We've also got the addition of our Teams page. We've also got our OneNote notebook, which again will have copies of all the lecture materials, workbooks, tasks and things for you to be working through. So you will have access to lots and lots of different resources to help you as we go through this module. We'll also be doing a lot of tasks and supportive work within the directed study sessions of your days for you to actually be focusing your research and the key things that we're going to be looking at each week into your specific medication and what this might mean to help support your assignment. So some recommended reading for you. There's some examples of some resources within this PowerPoint. I also have some resources on the Teams page. There's resources on the OneNote notebook that you can click straight through to or that you can have a look at within the notebook. There's lots and lots of research that I would want you to do. So I've put some things on here. I've put the NMC links. We've also got the HCP links on the OneNote notebook. You can get pharmacology textbooks, and these can be accessed in person, or you can use the ebooks section within the library search. We've got medicines management textbooks. Again, these can be physical books or they could be accessed through ebooks through the library search. And calculation skills for nurses books. Again, these might carry some key information about when we're thinking about administration of medication or safe administration of medication for learning outcome 1 and 4. So there's lots and lots of different resources that you can use. I would also, as I said earlier within this little video, recommend that once you've picked your medication that you do a little bit of research on your specific medication. Because while these are the general sources of information about maybe the legislations, the backgrounds, how we can follow policies and procedures to actually acquire the medication or to deal with it or to safely dispose of it. As I said, for the pharmacology section for learning outcome 2, you really need to be thinking specifically about your chosen medication. So it's really key that you actually do some research on your specific medication. So as I said, there's a couple of links to some books which are a little bit useful. So there's a numeracy clinical calculations for nurses. And then we've got a couple of medicines management and calculation skills, student survival skill books. There's also, as I said, links to the NMC legislation pages, the HCPC legislation pages, the Royal Pharmaceutical Society legislation pages within Teams and the OneNote notebook. So there are lots and lots of different resources out there to support you and to help you through this module. Lastly but not leastly, any questions? If you do have any questions from the overview of the assignment, what I would like to do is to contact me, send me a Teams message right on the general Teams discussion, because again, if you have questions, other people might have similar questions, so these questions might be really useful to everybody to have a look at when I get back to you about them. Or if you don't feel comfortable doing that, again, as I said, send me an email, send me a message through Teams, and I'll hopefully get back to you as quick as I can and help you with that question. Obviously, we'll do a lot more discussion within our seminar sections, and we'll look at how these things are going to come together to actually to support our learning and to help you meet this assignment. So thank you, and I shall see you later. Bye!